So heroin is derived from morphine, and it's a highly addictive drug. It's been around for many, many, many years. It gives people a high, especially it can be smoked or it can be injected. And especially when it's injected, it can be very dangerous as well. So what it does is it enters the brain and it goes to certain receptors in the brain that are in the pleasure centers of the brain, and those are stimulated. Dopamine is released and the person gets a high from that. That high typically will last maybe a half hour or so. So an average heroin user who's using it IV, for example, will be using it maybe 4 to 6 times a day. The problem is that it also can be contaminated with certain contaminants. We've seen recently that in 3 states there have been over 50 deaths because of fentanyl being combined with the heroin. Fentanyl is a much more potent opioid. So these opiates will go to the brainstem, and it's there where our centers for automatic breathing and that regulate our heart rate are there. And so with the use of an overdose, in an overdose situation, for example, heroin can rapidly kill someone by suppressing their respiration or stopping their heart. The high doesn't last that long, and what you do is you get a marked release of the pleasure chemicals in the brain that are rapidly released. Normally for things like food, sex, other activities that are important to life, dopamine is involved, but it's a much slower release. Here, after you use heroin, for example, there's a quick spike in the dopamine levels in the brain, which make it very reinforcing. And so then you get the blood levels that come down, the pleasure comes down, and then over a period of time, the person is left feeling more depressed, dysphoric, looking for the next high. So it just becomes a vicious downward cycle. What we've seen is that there's been the emergency room visits, the number of deaths due to heroin use have really paralleled the number of the increase in prescription opioids in the last 10 to 12 years. And so what you will see oftentimes is someone, for example, who started off on OxyContin or a medication like that. This OxyContin's been in the news quite a bit and is the so-called gateway drug for some people. But what will happen then is that they become addicted to it, and then they go through this downward spiral. It's expensive. An 80 milligram OxyContin typically will cost $40 on the street, whereas then somebody will find out that a dime bag of heroin, which will get them a high for 4 to 6 hours, is probably about $10. So it becomes much less expensive. And so what we're seeing now is we're seeing more heroin abuse in the middle class and younger individuals. And it's not really known exactly why that is, but certainly one of the things that could be is that because of the more prevalent prescription use, which has occurred over the last 10 to 12 years, we're seeing individuals who have developed an addiction over that period of time looking for a cheaper alternative way to get a high. It's very addictive. If we compare it to other drugs, for example, marijuana, 9% of people who start using will eventually become addicted to it. Cocaine, 17%. For alcohol, it's 15%. But for heroin, that's 25% or more. So it can be very, very addicting. The other concern that I just found a study that was interesting that looked at 115 heroin users, and they combined it with 115 non-heroin using controls, and they compared the death rate in between these two populations. Now, you always have to kind of read these with a critical eye, but what was very interesting is that the mortality rate in the heroin users was 63 times that in their non-using controls and their non-using peers. So it is a potentially very deadly drug. From 2011 to 2012, there was an 85% increase just in 1 year of heroin deaths in the city of Minneapolis. Now that's, in 2012 that was 37 individuals. In 2013 we went up another 50% to 57 individuals who died from heroin overdose. So there's a tremendous public health impact that this has here. In a lot of cities, people are beginning to think very creatively from a public health standpoint about what can we do about this. Well, certainly recognizing that there's still a lot of stigma associated with addiction, so people oftentimes don't want to step up for treatment. So encouraging people to go to treatment, letting people know, educating people about treatment facilities that are available and that there is help available. Even for those individuals who are out there and using and don't want to come to a treatment center, what we know is that about 85% of people who overdose with heroin do so in front of someone else. So many cities are now turning to providing naloxone, which is an opioid reverser, which will overturn the effects of heroin. In an overdose situation, they're providing them at public health clinics, at homeless shelters and other places where people can be. And in New York City, I think it was, they estimated that in the last few years they've passed out 20,000 of these kits, and to the best of their knowledge, about 500 of them have been used thus far. But that's 500 people saved, most likely, that wouldn't have been saved. So it really calls out for creative thinking and a public health response. And that's the message that we should be taking away from this, that it's prevalent, it's out there, it is deadly, but it doesn't have to be. There is hope out there if people are able to access the assistance that's there.